Hello, my name is Emirami, and today I'm going to be doing my trach suctioning skill video. I'm going to be practicing general principles and safety practices. I'm going to go into my patient's room, knock, identify myself, and identify my patient with two patient identifiers like name and date of birth, and check their wristband. I want to assess for allergies, specifically latex, because we're using sterile gloves. First thing I want to do is perform a respiratory assessment. So I'm going to perform hand hygiene and don my clean gloves. I'm going to be listening to their lung sounds first. We'll listen to the front side first. Alright, we're going to assist them to a sitting position and listen to the back. Alright, now that we've auscultated their lung sounds, we're going to count the respirations. I've counted 60. We're going to assess the symmetry of their chest and the effort they put into their respirations. We're also going to take their oxygen saturation, so we're going to put a pulse ox on their finger, and I got 96%, so we're good to proceed. I'm going to remove my gloves, perform hand hygiene, and perform a pain assessment on my patient. I'm going to ask my patient if they're having any pain. No, but if they were, I'd ask them to rate it 1 to 10, and then tell them any time during the procedure. If they're having pain, they can put their fist up to let me know. Now I'm going to put a waterproof pad on my patient and my face shield on, so I'm going to perform hand hygiene and set down my waterproof pad on my patient's chest. Put on my face shield. Now we're going to turn on suctioning and oxygen. So we're going to turn on oxygen for our ambu mask, and we're going to turn our suctioning onto continuous and turn it up no more than 150 mercury. So for adults, it's no more than 150 mercury. For adolescents, it's no more than 125 mercury. And for infants, it's no more than 100 mercury. And we are going to test this suction. Make sure it doesn't go over 150 mercury. We're good. Now I'm going to perform hand hygiene and open my sterile supplies. I'm going to set up my box first. The inside of it is sterile, so we're going to pour sterile saline into there. Alright, now we're going to perform hand hygiene and open up our sterile packaging to don our sterile gloves. All right, let's fix this up a little bit. All right, now we're going to grab our tubing with our dominant hand. We're still sterile, so we can manipulate this. I'm going to take my non-dominant hand and grab my suctioning and connect it to my tubing. Now my non-dominant hand is not sterile now. My right hand's still sterile. We're going to check our suctioning, so we're going to put it into the sterile saline and check our suctioning, and it's good. So now we are going to hyperoxygenate our patient with 3 times. All right. Now that our patient is hyperoxygenated, we can insert our catheter into the suction. On the way in, we're not going to apply suction. And we're going to insert it 1 to 2 inches or until we meet resistance. And on the way out, we're going to apply intermediate suction and gently swirl. We can't do this no longer than 10 to 15 seconds. Right, now that we have sectioned the trach, we are going to see the need if we need any additional sections for our patient's secretions. And if we did, we would hyperoxygenate the patient again, but we can't do this more than 3 times. And at this moment, our patient does not need any additional sectioning, so I'm going to dispose of my supplies appropriately. Alright, and now I'm going to perform hand hygiene and reassess my patient's respiratory status. So I'm going to listen to the front, sit them up, listen to the back. Alright, and now we listen to it. We're going to count the respirations again, assess symmetry and effort they put into the respirations, and take their oxygen saturation with the pulse oximeter, and everything looks good. So now I'm going to get my patient comfortable, and I'm going to document and record everything that I have done today, and just make sure to keep checking on my patient.